clinic in Kelowna is doing what they can to reshape how people deal with chronic pain, depression, and anxiety. Those struggling with treatment-resistant depression can now turn to EntheoMed, a clinic that specializes in ketamine therapy.
It's just been, an honor to be able to create EntheoTech and be able to serve people in that way and really see how it's dramatically shifted people's lives. We've seen anything from, sexual assault survivors, people in the military, people in the RCMP, people who have lost children. So it's been really cool just to see the broad spectrum of how we're helping there. And then even, entrepreneurs, working professionals, executives that are struggling just with burnout and stress.
These ketamine sessions involve intramuscular injections while sitting in a recliner with a weighted blanket, curated music, and an eye mask, encouraging the patient to look inward, digging up their past trauma to start the healing process.
My experience in talking with people that have done, SSRIs, antidepressants, is more of a numbing effect. They're trying to alter your brain chemistry, but recent research has shown that the model of depression where it's like, oh, your brain chemistry is imbalanced, is false. With that eye shades and headphones and the weighted blanket, we're really encouraging that inner experience and helping the person prepare to be able to breathe through and feel anything that comes up in that experience. And it's the big thing, you have to feel it to heal it. And that's really where people are having that profound shift in their sense of self, is when they go through these experiences. It's like getting threaded through the eye of the needle. It's like you have that experience and it's like wringing out the cloth.
Johnston tells Castanet ketamine therapy is the catalyst that puts you face to face with what's causing your depression, and that the real work is done through counseling with a therapist at the clinic who specializes in psychedelic therapy.
We always say you get the experience you need, not the experience you want. So what we can do is we can help the person prep for that, but really once they go into that medicine session and that experience, you don't know what's going to come up. It might be something from childhood, something repressed, something that happened 2 weeks ago that you didn't know. So that's the biggest thing, is about having that person feel relaxed and comfortable so that whatever needs to come up can come up and that can be processed. And then they have the support there with the nurse and the therapist to really help integrate and understand that experience.
While stigma around psychedelics and a lack of education remains to be their biggest challenges, EntheoMed is confident this is the future of mental health care. If you struggle with treatment-resistant depression, you can now turn to your family doctor for a referral. I'm Braden Ursel in Kelowna for Castanet.